Well, first of all, I would like to thank you all for taking your time and travel to be here with us in Brussels for this very important event. In developing the Commission's proposals on rare diseases, a central aim has been to listen to what patients want and need. Today, we hear loud and clear some of the voices of more than 30 million European citizens who suffer from rare diseases. And I warmly congratulate EURORDIS, the European Organization for Rare Diseases, for its excellent initiative in creating Rare Diseases Day.
Thank you very much, Commissioner Vassiliou, for hosting this event this morning and for your strong commitment to promote rare diseases as a public health priority on the European agenda. Public health policy is not about bureaucracy and political decision-making process. It is about the identification of citizens' needs and expectations and in taking action to address them. And to do so, policymakers need to rely on data. And this is the first merit of this EURORDIS book, The Voice of 12,000 Patients, is that it allows to go beyond anecdotes. It allows to gather a huge amount of data and the real life experience and expectations of people living with rare diseases to access diagnosis and access care in Europe today.
The success of this strategy depends very much on the commitment of the Member States to take action on rare diseases within their own national health systems. That is why we also proposed a Council recommendation on European action in the field of rare diseases. So I'm glad to welcome Professor Milan Masip, representing the Czech presidency of the Council.
I would like to assure you that the Czech presidency is fully committed to the so-called rare disease agenda and that we are doing our best to succeed in adopting the proposal for the EU Council recommendation on European action in the field of rare diseases.
Through our health program, we already have some pilot European reference networks, such as the European Centers for Reference Network for Cystic Fibrosis, headed by the clinic of the Goethe University in Frankfurt. I'm glad, therefore, to welcome Professor Thomas Wagner from the clinic here today, who I hope will be able to give us some practical insights from his work.
My name is Thomas Wagner. I'm a healthcare professional. I'm a medical doctor. But I'm standing here because I'm coordinating one of those pilot projects on reference networks in Europe. And it's very important to stress that I stand here for a group of people involving very heavily patient organizations. So our networking is not just a networking of healthcare professionals, but it's a networking between healthcare professionals, care team members, and patient organizations. This is what I consider a comprehensive reference network or a comprehensive network of expertise, because patients have to be involved and helpful in deciding what we do.
No, I think it has been an extraordinary initiative, and the important thing is that the Commission has assumed not only for the pleasure, but because it's also part of the Commission communication on rare diseases, which mentions the European Rare Diseases Day as, if you want, an obligation from the European Commission in the next years. But there are obligations that are really disagreeable, and there are obligations that are a real pleasure, and this one, it was a real pleasure. And I think that the engagement of the Commissioner, Mrs. Vassiliou, plus the experts that were here, and the engagement of the Czech presidency, gives to this European Rare Diseases Day 2009 a special relevance.
In general, however, European action in the field of rare diseases is one of the topics that has attached general consensus throughout the European institutions. I am pleased to see several members of the European Parliament supporting this event here today. I also welcome staff from the European Medicines Agency. Their role in implementing the community framework, supporting the development of orphan drugs, is a vital part of European action for rare diseases. When I launched the Commission's proposals last November, I said that we wanted to bring patients with rare diseases out of their shadows. This book, The Voice of 12,000 Patients, helps to do exactly that. I hope that the Rare Diseases Day will provide a platform for us all to hear those voices, to help guide and inspire us as we continue our work on rare diseases into the future. Thank you.